Do you have numbness and tingling sensations in the hands, particularly in these three fingers? Worse at night time. You wake up in the middle of the night or early morning, you feel like your fingers are tight and numb. You feel like you have to shake them off to feel better. You went to the doctor and you were diagnosed with carpal tunnel syndrome. Today we're going to be talking about one of the treatment options for carpal tunnel syndrome. We spoke in a previous video about carpal tunnel syndrome, which is compression of the median nerve as it crosses the carpal tunnel and it produces those symptoms. The symptoms are worse at night time. If the compression is mild to moderate, then the first line of treatment is a wrist splint, and that's what we're going to be talking about today. This is the wrist splint that we use for carpal tunnel. The most important thing that it has to have a metal bar in it to prevent you from bending your wrist or hand. And that's why if you keep your hand straight, you keep the nerve relaxed and you do not compress the nerve, the body heals itself and the nerve heals itself. You have to wear the splint at least 2 to 4 months. You have to wear it in 24 hours. However, if you can't because it interferes with your daily activities, then most importantly, to wear it at night time, because at night time we tend to bend our wrist and therefore compress the median nerve, and therefore the symptoms are worse at night time. Of course, to determine the severity of carpal tunnel is based on the nerve conduction test. Surgery is left as a last resort if everything fails, and surgery is left if you have weakness in those fingers. But the first line of therapy is the wrist splint. Now, if the relief, you could feel the relief immediately within a day or two. However, it can take up to 2 to 3 weeks before you feel the relief. If you still have severe symptoms with wearing the wrist splint, then you can get a median nerve block or injection within or inside the tunnel that can help relieve the symptoms while you're wearing the wrist splint to allow the nerve to heal. But the wrist splint is the first line of therapy for carpal tunnel syndrome if it is mild to moderate. Thank you.